This is a presentation on how to treat the Romani people in clinical practice. We will be exploring some of their struggles and how this may relate to mental health care. Disclaimer: the terms used throughout our video are Romani and Roma. It is important to note that a widely used term to describe the Romani people is gypsy, but we will be refraining from using this word as it has negative connotations and is considered a racial slur. The World Romani Congress distinctly rejected the use of the word in 1971. The Romani are an ethnic group who live all across Europe, with bigger populations in Romania, Spain, Turkey, Bulgaria, and Hungary. They are one of the largest minority groups in Europe, and they have a rich culture with their own languages, food, dances, and clothing. The Romani have faced a long history of discrimination, such as deportation and being pushed out of their communities, creating mistrust with authorities. Romani people are often considered a hard-to-reach group, struggling with a higher risk of socioeconomic disadvantage and social exclusion. This makes them less likely to be represented in research studies. They experience widespread discrimination and disadvantage in their day-to-day lives, such as restricted access to employment, poverty, low education and literacy levels, and lack of adequate housing. When it comes to barriers in healthcare, the Roma are 3 times more likely to report unmet health needs. They are less likely to have access to dental services, cervical screenings, or immunizations. Due to all of these factors, the Roma are at a higher risk of mental illness. These contributing factors are compounded by unfair social policies and individual experiences of discrimination. Roma children have a higher burden of mental health, and Roma experience higher rates of anxiety, depression, suicidal ideation, and suicide attempts that are 3 times greater than the population average. Shame in general can be triggered from failure to live up to other people's expectations. Lack of control over their daily lifestyle as a consequence of cultural alienation leads to increased stress and psychopathology. Discrimination can have an impact on different clinical stages. Information gathering might be hindered by bias and differences in communicational styles or use of expressions. Symptom presentation may differ in Romani patients as they are highly underrepresented in research. During clinical interviewing, it is important to consider use of language and potential cultural differences and norms. During alliance building, it is important to be open-minded, for example, to ask questions about daily practices and cultural perspectives to establish a mutual understanding. Also take into account different values when setting goals and use appropriate language. When considering intervention, it is essential to consider educational levels for psychoeducation, understand values, and establish mutual expectations. The treatment setting has to be easily accessible for patients with low socioeconomic status. For example, public transportation costs or limited access to internet might hinder this. Romani culture is generally collectivistic and family-focused, which means the inclusion of community members could be beneficial. On the other hand, stigma of mental health has to be considered. Inquire about their preferences for treatment and use their language. Some general recommendations we have for clinical practice in treating Romani people are cultural humility and sensitivity to strengthen the therapeutic alliance. Cultural awareness training can also be helpful given that it doesn't contribute to reproducing stereotypes. It is important to inform yourself about the culture of the Romani people and take into account the multiple identities and social realities which they live. Avoid microaggressions and stereotypes. Be willing to listen and ask questions when needed. Lastly, navigate value differences and make sure to focus on what the client finds most important, discussing your goals together. Thank you for listening, and consider learning more about the Romani people to adequately help them in mental health care.